Hi, I'm Moniodis. I'm a pulmonologist, and I am the co-director of a pulmonary hypertension program at Austin Heart, which is a part of St. David's in Austin, Texas. Pulmonary hypertension and ILD have a relatively close relationship in that ILD can lead to the complication of pulmonary hypertension. For example, in idiopathic pulmonary fibrosis, it is thought that a high percentage of patients over time will develop the complication of pulmonary hypertension. Other interstitial lung disease, or ILDs, also will have the chance of developing that complication as well. The signs and symptoms of PH-ILD can initially be hard to detect. Pulmonary hypertension often presents with shortness of breath and intolerance to exercise, but these symptoms can already be present in ILD alone. Oftentimes, patients who develop PH in ILD will notice that while they had previously been on stable levels of oxygen or had a stable exercise capacity, that there has now been a change. There's a need for more oxygen, or their exercise capacity has decreased, and this may suggest the possibility of PH, or pulmonary hypertension. In advanced stages, there also may be symptoms that suggest that there is evidence of right heart failure. So that may include symptoms like chest pain, syncope or passing out, or swelling in the legs. So PH-ILD is diagnosed similarly to other forms of PH, which is by a right heart catheterization. Initially, an echocardiogram may be done to determine if that right heart catheterization should be performed. An echocardiogram is an ultrasound of the heart that can give hints or suggestions that pulmonary hypertension is present. After the echocardiogram, if the concern for pulmonary hypertension persists, then the step is to proceed to that right heart catheterization, which is a test in which a catheter goes into the heart and directly measures the pressures. The main risk factors for developing PH-ILD have to do with the type of ILD. Idiopathic pulmonary fibrosis is the most common type of ILD to see PH. It is also the most common ILD overall, so we do see more pulmonary hypertension in that population. The treatment options for patients with PH-ILD have recently become more available. Historically, we had supportive measures such as treatment of the ILD, maintaining good oxygen levels with supplemental oxygen, and diuretic therapy to help with any swelling. As of 2021, we now have inhaled medications that are within the prostacyclin class, which help dilate the pulmonary arteries using the inhaled method of delivery. The important thing about treating a patient with PH-ILD is to remember that treating PH-ILD is a separate disease process than just group 1 PAH. They are certainly similar, but there are treatment options for other groups of pulmonary hypertension that are not appropriate and may actually even be harmful in PH-ILD. So really having that personalized, individualized approach to treating PH-ILD and emphasizing medications for that particular type of PH is very important. So, lifestyle approaches for patients with PH-ILD, I think really the most important thing is oxygen supplementation. So, if you as a patient with PH-ILD know that you need oxygen with walking or with sleeping or even a rest, maintaining your oxygen level above 88% is really the most important thing that you can do, because lower oxygen levels can worsen your PH-ILD. So really making sure you have a home pulse oximeter, follow your oxygen saturations, and have an oxygen delivery system that works for you. The prognosis for patients with PH-ILD is worse than patients with ILD alone. However, much of the data that shows this decrease in life expectancy and quality of life is from times before we had current treatment options. With inhaled pulmonary vasodilator therapy, there is emerging data that shows improved functional status, prognosis, and quality of life for those patients on treatment. There is ongoing research in the field of PH-ILD and some emerging treatment options. Currently, we have inhaled pulmonary vasodilator therapy that comes in certain devices, nebulizer devices, and inhaled powders. And there are some new options that may make the frequency of dosing less and may give patients more options for different inhaler types that best fit a certain patient's lifestyle.